Hi everyone, welcome back. Last time we discussed about contraception and we said that contraception is the deliberate use of any method, devices, sexual practices or surgical practices to prevent pregnancy. It's actually a deliberate method and we mentioned that it has different types. The sexual practices can include being abstinence, abstinence, then calculation of safe period, use of coitus interruptus. Then we talked about artificial method, which include use of drugs. We mentioned the pills, the mini pills that can be taken, both the progestogens only and the combined oral contraceptives. We mentioned the injectables that can be taken. We mentioned the implants, the devices. We mentioned the intrauterine contraceptive device, the one that is put inside the woman's part, body. Then we mentioned use of surgeries like bilateral tubal ligation, the vasectomy. These are methods that can be used to prevent pregnancy. Other things we didn't mention that we mentioned include transdermal patches and vaginal rings. These can be used to prevent pregnancies, amongst others. Now we'll come to this. What I'm holding is the injectable. We have the two forms. We have the non-estirate, and this one contains norethisterone enanthate. It is actually 200 milligrams of norethisterone enanthate, and it's taken every 2 months. Every 2 months means that you take it this time, 2 months again, you take it, it's given intramuscularly. Then we'll have the normal Depo-Provera, this one is taken every 3 months. It has its disadvantages and advantages. The advantages of these drugs is that it has a longer duration to be taken. 2 months, 3 months actually long. Unlike the pills that you take every day that someone may actually forget. So this one is taking 2 or 3 months depending on the one you are taking. So another good thing about it is that it prevents the risk of ectopic pregnancy, it prevents the risk of endometrial cancer, and it helps in sickle cell crisis. So someone that is a sickler that is on this may actually have reduction in her sickle cell crisis. What the disadvantages of this drug is that it can lead to increase in weight gain. So if you're actually big and you're taking the drug, it may increase your weight gain. Then it can lead to reduction in bone mineralization. For someone that is on this drug, you may start having issues with her bone. It doesn't mean that it can happen to everybody, but if it can happen to anybody. So it can lead to bone reduction in the bone mineralization. The person will start having issues with her bones. Then it can also lead to amenorrhea. The person will not see her period at all. So it's not a cause for alarm. That's one of the side effects. And it can, in mono pills, I said that return of fertility is prompt. However, in this one, return of fertility can take up to 10 months to 1 year before the person, let's assume that you want to get pregnant and you stop. Your fertility may not return till about 10 months to 1 year. Those are the disadvantages of these drugs. These are the injectables. So we're not going to talk about other forms, the implants. I have the implant here. This is the Jada, as I mentioned yesterday. I hope the camera picks it well. So I'll be showing us Jada. This is Jada. This is the Jadel. It has two rods. It contains 75 milligram of levonorgestrel. This one is Jadel. It is put on the upper arm. It is put on the upper arm here, and it lasts for 5 years. It gives contraception for 5 years. So if you're looking for anything that is long lasting, you can go for Jadel. Jadel is for 5 years. So this must be inserted by a health worker, because it doesn't need to enter into the muscle. We put it subcutaneously, so that it can be feeling the rods. The two rods will have to be there, and another disadvantage is that it has to be removed by a health worker, and it's done under local anesthesia. It's not going to pain you. We insert this one. So another disadvantage about this form of contraception is that the person may start having irregular vaginal bleeding. So whoever that is going to be on this contraception will counsel the person appropriately and tell the person that one of the disadvantages is that they may still have irregular vaginal bleeding. The same with Implanon. This is Implanon. I brought it out yesterday. This one offers contraception for 3 years. It is already loaded. This is Implanon. It's already loaded. I just remove it, put it under the arm, and it offer contraception for 3 years. It's for subdermal. We don't put it into the muzzle. This one is easy to load. It contains 68 milligram of ethanol glycerol. Now, it's the same thing with Jadel, the advantages and disadvantages. Person may just present with vaginal bleeding, unpredicted vaginal bleeding. So we cancel the patient. But most of them will still have amenorrhea. Amenorrhea means that they will not see their period. But another good thing about this form of contraception is that return of fertility is prompt. Unlike the injectable, when you remove, just be getting ready to get pregnant. That is that about this form of contraception. I'm making this video so that nobody comes and says, I'm getting pregnant on what getting pregnant as a married woman without planning for it. So this is it for implant no. Now we have the intrauterine contraceptive device. This is the intrauterine contraceptive device. This one, I don't know whether you can see it. Okay. This is the look at it here. This is the intrauterine contraceptive device. This one is a T-shaped intrauterine system. Contains, you can look at it here. It's long acting, but it's reversible and is not dependent on coitus. Not dependent on coitus. We have this one. This is the copper T. This one is the copper containing intrauterine contraceptive device. We have Mirena. I don't have the Mirena here. The Mirena contains levonorgestrel. That is that about contraceptive device. The advantage of this is that it lasts for 10 years. This is copper T, while the Mirena also is progestogens. So the good thing about this one is that it lasts for 10 years, so it's long acting. And if this one has a string, you can always feel to be sure whether it's still there. But it may be associated with some abnormal bleeding. Cramps, lower cramps, lower abdominal cramps when inserted, especially for the first 6 months of insertion. So it may be associated. How it works is that it causes inflammation in the uterus, in the womb, making that and releases some fluid that is toxic to sperm and to egg. So it prevents sperm from transporting to fertilize the eggs. Then it prevents implantation from happening. That is that about this. It makes the environment very toxic for the sperm to survive, but it increases the risk of ectopic pregnancy. Now, it also increases the risk of pelvic inflammatory disease. Before we start this, we make sure that you are in a monogamous family setting, or rather a monogamous relationship. We do not want you to have someone that has multiple sexual partner, so don't go get infection and give to you, because it increases the risk of ectopic pregnancy, increases the risk of pelvic inflammatory disease. Now, if someone that is actually having vaginal bleeding, or have active infection going on, or have infection following delivery or post miscarriage, we don't insert this. That is that. But for that Mirena, the one I did not show, it has advantage of reduction in blood loss. These are that for this. Now we're going to talk about the barrier method. Now I have in my hand the male condom. This is one of the barrier methods. We have other ones like the female condom, the cervical cap, we have the diaphragm. The advantage of this is that it prevents sexually transmitted infection when used appropriately. It also can be used to do transvaginal ultrasound. That's one thing with it. Now, it prevents sometimes the infection with human papilloma virus, the ones that give cervical cancer, the one that gives genital warts. This can help to prevent it. It can also be used. It can also help to if there is no spermicide there, some people can use it to collect seminal fluid for analysis, that is for sperm tests. So those are the advantages of this. But the disadvantage is that it may not be properly used, and if not properly used, the person may have come with pregnancy or sexually transmitted infection. Then if you do not if it bursts, the same thing can happen. Then it can slip into the genital tract when not properly used, and the person, if you use latex, for most people that react to latex, they may start reacting to it and even come with severe reaction following it. That's that about this. If you have not subscribed to my YouTube channel, please subscribe at OBGYN Talks with Dr. Adazion. Follow me on Facebook at OBGYN Talks with Dr. Adazion. I'm on TikTok and on Instagram with the same name. Thank you for watching to this point. We're going to talk about other forms, which include sterilization, vasectomy, and the natural method, how to calculate your safe period. It's going to be a very detailed lecture on its own. Thank you. See you next time for another enriching video. I remain Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Thank you.